confirmed COVID cases have continued to fall in the United States as more Americans are vaccinated, and the weather has also turned warmer in the country. According to media reports in Johns Hopkins University, the 7-day average case numbers have hit a level not seen in many months. Well, to talk more about the US's fight against the pandemic and also what India can learn from it, we're now joined by Dr. Rohit Gulati, Chief Medical Officer, Einstein Healthcare Network from Philadelphia. Thank you so much, Doctor, for joining us and speaking to us. Now, I know you're all watching the situation here in India with great concern. You've dealt with COVID surges yourself over there. What can you tell us about, urgent steps on containment that can be taken and what lessons we can learn?
First of all, Gargi, thank you for inviting me to your panel. Glad to be here. And yes, we are concerned. The world is concerned, not only the Indian diaspora in the US, but the entire world is concerned as to how we can help control or even show some light on this. So maybe I think the way to do this is to dial back to about 14 months ago when this all started. As you know, we had a major epidemic in the US as well, and our case numbers were very high. You read stories, coming out of Italy, followed by New York City, and how New York City, got battered with COVID and hospitalizations were full. So I think, to look at it, the way I look at this is to look at how we contained the virus the first time around. So the containment strategy was key because at that time there was no vaccine, there was no treatment. Remdesivir was not, there was nothing. It was just a virus and mankind. What we learned very rapidly from Wuhan and Italy was that this spreads very, very fast and it's airborne. So we knew that, very different from Ebola, that this would catch fire in the US, which it did on the West Coast coming into Washington State and Los Angeles, and very rapidly spreading to the rest of the country. What we learned was that you have to keep your eye on the case rate. The case positivity rate defines how you open things or how you close things. Currently, the case positivity rate in Delhi is 22% or so from what I read. Yes. We never had a case positivity rate in the 20%. The maximum case positivity rate, in Philadelphia, where I am, was about 11 or 12%, and that we felt was extremely high. Our comfort level with the case positivity rate is below 5% to say we can start easing things up. So I think there has to be a structure nationally and at every metropolitan city led by the mayor or the governor who gives data every single day as to what the case rate is and which direction it's going in. That will define how you lock down or open up.
Right, absolutely. In fact, Delhi, positivity rate has come down slightly, but the national positivity rate remains above 20%, and our hospitals are already overwhelmed. In some states, it's even as high as 30%. There's a shortage of beds, there's a shortage of oxygen, even medicines, even healthcare workers. So it's a real crisis on the ground.
So that is critical. What we learned in the city of Philadelphia, now Philadelphia is the 10th largest city in the US, and we have major academic medical centers. We've got the Hospital of the University of Pennsylvania. So Penn sits in Philadelphia, Temple sits in Philadelphia, Jefferson sits in Philadelphia, Albert Einstein Health System sits in Philadelphia, along with Mainline Health. What we decided very, very early, and again, it's local leadership plus hospital leadership combined to be able to contain this. We started having meetings with all the chief medical officers of all the hospitals and the city on a daily basis to say, give us a pulse check on the city. Plus, we were able to tell all the other hospitals what was happening with us locally. So we were able to load balance in the sense that we knew that if Penn had beds, we could transfer patients to Penn and vice versa. The second key piece is to stop all non-essential surgical procedures and admissions to hospitals. Every single cataract surgery, hernia surgery, any hip replacement, knee replacement, something that can be postponed by 2 or 3 weeks without causing any major impact to health should be postponed. What that will do is it will free up operating rooms, ventilators, anesthesiologists, doctors. Now you'll say, how does it make sense if an orthopedic surgeon is freed up or if a urologist is freed up? They can all help treat and do what everybody else is doing. So what we did was we canceled every non-essential surgery at every hospital. It was a state mandate. It came from the state that you cannot do non-essential surgery. And that freed up a lot of rooms. It's freed up a lot of personnel, a lot of nurses who we were able to mobilize for the treatment of COVID.
All right. So currently we're now pushing the vaccination drive aggressively, though we're facing a shortage of doses and it's not going as fast as we would have liked it. We're hoping, of course, to have more vaccines and also more types of vaccines available soon in India so that we can vaccinate more and more people, as that's the only way to counter this.
Absolutely. I think vaccination is the only way to stop it long term. But, we've learned even without vaccines, you can still control it. You can damp it till the vaccines come through. So I think India is in that stage that they need to contain and they need to free up hospital capacity and space and then start vaccinating as much as they can. Now, they've already vaccinated some of their 55-year-olds and 65-year-olds and older, which is a really good thing. Once the vaccines are available more freely in India, which I think they will be, very shortly, and the CDC is going to give authorization to Pfizer for 12 to 16. So 12 and over will start getting vaccinated in the US by I think next week or the week after. And by September, we believe that 2-year-olds and over will get emergency use authorization. So children 2 and over will get vaccinated. Right now, the disease hasn't been as severe in children. We haven't had as many deaths. The way it manifests in children is very different than in adults. It causes what's called a multi-system inflammatory syndrome in children, or what was similar to Kawasaki's disease in the past. But the mortality still remains very, very low in children. So I think it's key to vaccinate the entire population. Gargi, one thing though I have to say that you cannot isolate countries, you cannot vaccinate countries in isolation. It has to be a global vaccination drive because this virus spreads so fast. So if you have a country like India or you've got Africa that are not vaccinated currently, that could be the next super spreader country.
Right. Well, thank you so much, Dr. Gulati, for speaking to us here at NDTV, and really thank you for keeping an eye on the situation here and reaching out. Well, that's all the time we have on the show today. Thanks so much for watching. Goodbye.